are very lucky to live in Camarillo. I'm not just saying that because this is where I live too, but we are lucky enough to have a special healthcare district here in Camarillo. This is not something that every city or county has. The closest one to us that's even remotely similar to us is in Seal Beach, Orange County. There is one in the Lompoc area, but they oversee a hospital. So we're different. We're here to provide the community with more of the social services. As you see up there, we were formed in 1969, and we are empowered through legislation to use property tax for health and wellness services. And we feel that being able to do that with the choice of evidence-based programming, meaning that these programs were designed by a research or education institution, studied over years and years, and show the results of that program work. We've seen that they can help and do help caregivers and those who utilize our services. And we did receive an award for our Caregiver Center from the Rosalind Carter Caregiving Center out of Georgia for the Leadership in Caregiving Award. So the district's Caregiver Center was the first federally designated family caregiver resource center in the county. Established in 2009, we are now one of 3 caregiver centers in the county. East County is Senior Concerns. They cover Newbury Park through Simi Valley. The Camarillo Health Care District Caregiver Center, we cover Camarillo, Somas, Santa Rosa Valley Road, and the unincorporated areas of Camarillo. And then Oxnard and up through Ojai, Fillmore, Santa Paula is the Ventura County Area Agency on Aging's Caregiver Center, La Buena Vida. We have some really fabulous programming that we receive grant funding through. As you can see up there, Title IIIE, what does that mean? It's just a form of funding that comes through the Older Americans Act. The Older Americans Act was passed following the creation of Medicare in 1965. Just designed with the idea of we need to have more supportive programming and funding for older adults in the community. And with this Caregiver Center, it was actually my old boss who had the idea, we need a place that can be a sanctuary for family caregivers. She herself was a caregiver for an adult son and saw there aren't as many resources as we need. So when the Area Agency on Aging said, hey, there's this opportunity, what organization wants to be the first? She said, we do. We, right here, Camarillo Health Care District. And what a blessing it has been. Because as we are seeing, more and more people are taking on the role of being a family caregiver. I teach at Cal State Channel Islands as well. I have students who are 15, 20 years younger than me who are also taking on that role. We work with individuals who are 20, 30 years older than me who are taking on the role. Being a caregiver, it's limitless. It knows no age, no gender, race, ethnicity. But what we are able to do is support you in that journey. We know that it is not a sprint, it is a marathon. And caring for a loved one, even when you do love them, it's hard. And so having the supports available to you can sometimes make it feel less hard. And when we look at caregivers, there is a cost that comes with being a caregiver. It is this impossible cost. Our caregivers are the backbone of our community. Without caregivers, our healthcare system would be in shambles, because what you are able to do is you provide hours and hours and hours of care that goes unpaid. But for people like us who work at the district, it doesn't go unnoticed. We see you, we hear you, and we support you. We understand that a good majority of our aging population, 83% of those living with a chronic condition, are cared for by a family or friend. More often than not, it ends up being one individual. And 48% of caregivers provide help to someone with Alzheimer's or another form of dementia. If we add that layer on top of a chronic condition or more than one, that is a challenging situation to be in. And we see that there is an emotional impact. Caring for someone with Alzheimer's or another form of dementia, it leaves marks. The care that you provide, you don't clock in and clock out. It's ongoing, it's 24/7. And you're managing symptoms, and it's symptoms that are unlike any disease. With diabetes, we know, okay, we have to watch our blood sugars, we have to watch when we eat, what we eat, our stress levels, hydration. But with Alzheimer's and another form of dementia, we are managing symptoms that are emotional or lack of emotion, apathy, being physically present and emotionally absent, aggression, anxiety, wandering. These behaviors are challenging, and no one has given a roadmap for someone to clearly follow, because it's unique per caregiving situation. And when we look at the cost, we see in the hundreds of billions of dollars. That is the equivalent of the care that you provide in a monetary form. If that were to stop, there's absolutely no way our healthcare system would be able to take on that burden and survive. So our caregivers, they are the vital support to our community, and it's our responsibility to provide that support. Because we know that we are seeing what's called an inverted pyramid for population growth, where we have a larger aging population than we have of birthing population or younger population. We know that as we age, a common denominator is we will need health care. We know that about 75% of health care is taken up by about 25% of the population. That 25% tends to be older. So if we are already in the billions, if we see that these costs are expected to rise to the trillions, everybody will end up paying a price. Without supporting the caregivers, without organizations like us to be able to come up alongside, this is even more unfeasible. I mean, I don't know about you, I can't wrap my brain around the thought of trillions of dollars. It seems like a made up number. But with the amount of people turning 65, in this nation every day, it's pretty awesome. And we in Camarillo have the ability to support that process. And as I was mentioning earlier, chronic conditions like congestive heart failure or diabetes, we know the symptoms to look out for caring for somebody with that kind of condition. Generally speaking, they're able to communicate with us, hey, I'm not feeling so good. Or you notice when they get on the scale, oh, they gained 5 pounds from yesterday. We got to get them to the hospital. But when we add that layer of Alzheimer's and other dementia into that mix of the chronic condition, we see that it costs more, because what Alzheimer's and other dementias does is it impacts our ability to communicate well, to problem solve. It impacts our judgment, our reasoning. These are things that help us when we are managing our health conditions. So it's a lot harder. And when looking at our primary care physicians in the community, we see them retiring at a higher rate. COVID's burned them out. And we see that more and more of them are saying, we are not ready. We are not ready for the growing number of patients that are going to be living with Alzheimer's or another form of dementia. If you've all heard of the actor Bruce Willis, him being diagnosed with frontotemporal dementia, that is not a common form. But what his diagnosis has done is it's brought it to the forefront. And I can tell you, in the last 3 to 4 months, we have had more calls from caregivers caring for a loved one with frontotemporal dementia than I've seen in the last 5 years. So I know that is just an anecdotal example of what we're seeing, but it coincides with what the trends are showing. And with caregiving, how many of you are currently a caregiver, have ever been a caregiver, are not sure if you're a caregiver? Just think, I'm a spouse, or I'm a friend, or I'm a sibling. Yeah. Our center is fabulous. I know I've said that to you like 20 times, and I'm gonna, hit you over the head with it. But one of the biggest challenges is people not understanding the role that they are when they are a caregiver. And so what we see that happens more and more is not taking care of yourself. For any of you who've been on a plane and a flight attendant says, okay, if the cabin loses pressure, the oxygen mask will come down, put it on yourself first, and then tend to your loved one. What caregivers tend to do is they tend to their loved one first, and then they pass out before they have the ability to put on their oxygen mask. Because it's always, the person I'm caring for, they are so important. I will put my doctor's visit off. It's okay, I don't need to go to the dentist. It's okay that I only got 3 hours of sleep last night. They had a really bad night. Our statistics are showing us the impact that caregiving has on people. We call it second patient syndrome. Nearly 70% of individuals in a caregiving role, they don't or aren't able to do that preventative health care. And because of that, their health declines. We don't want that to happen. We want to try to stop that. And that's one of the things that we aim for with the district. It's not just a one-stop shop where you come in once and you never hear from us again. We want to support you so that none of these things happen. So we come alongside you on your journey, not to annoy you or be an extra burden, but to remind you that you're not floating in the ocean by yourself, because that's what caregiving can feel like. We at the district, at the Caregiver Center, we are your floaties. Think of those, 2 big floaties that will keep you upright so you don't go under. Because we don't want to see poor immune function, increased rates of high blood pressure and heart disease, greater decline in happiness. I can't tell you how many times we see people come in and they'll say, I don't really know if I'm in the right place. And then they just start sharing their situation. And the next thing you know, they're sobbing. And they say, it feels so good to be able to tell someone what I'm going through. Someone who gets it. Because the staff that I work with, we've all been in a caregiving situation. I helped my husband care for my mother-in-law. She had cancer and rapidly progressing dementia. And by rapidly, I mean the last 6 months of her life, she went through all of the stages in 6 months. And your world doesn't feel real. You understand how these things happen because you just want your person, this person that you love to the moon and back, to be okay. But what we want to help you with is to tell you you're only as well as you are when you care for yourself. The care that you provide can only be good care when you take good care of yourself. Because what we are seeing is that a good majority of people in the community think, well, it's okay, I have it covered. I have family. My family here can help me. But California is expensive. There are changes in California that we hear a lot of people don't like. We're not going to debate that, but there are a lot of reasons as to why this often doesn't and can't happen. And some of us, we don't have family. So it may not really be an option. And if it's not an option, who then does it fall to? Well, maybe it's our friends, our neighbors. If we go to a faith-based organization, a temple, a church, whatever that may be, maybe it's our fellow parishioners, but that too is also not sustainable. Research shows that caregiving education can help family caregivers cope and deal with the stress and challenges of caregiving. Because even if we have family available, maybe they don't feel comfortable, or they don't understand what they need to do, or they don't understand how to respond. That education can help, and we do provide some of that. And even if the numbers are declining, we know that we have to provide opportunities to support those that remain. And so we see that there had to be an innovative response, an innovative approach to this increase in demand. What we were doing wasn't working, and it certainly didn't work now, coming out of a pandemic. Just thinking it'll all be okay, everybody can just figure it out on their own. No. What we have historically been doing is focusing on the patient, the person. And it's as if the caregiver just doesn't exist. That's not appropriate anymore. And we're seeing that shift. As a side note, the Caregiver Center was partnered with a couple local hospitals in the community, Dignity Health and Community Memorial Health Systems. And they embedded social workers in their, Dignity, it was a hospital, in CMH, it was in their ambulatory clinics. They embedded social workers in their system called caregiver navigators. And their whole purpose was to work with and support the caregiver. And when their services ended, they referred them back to their local caregiver center for that continued wraparound support. That is not something that would have happened 6 years ago. And so even though the pandemic was hard, the pandemic brought some great change, some innovative change. Because taking care of the patient, yes, it's important, but taking care of their person is just as important, if not more important, because they are the person who knows all of the red flags to look for. When do they not feel good? Oh, that time of day, usually that means they're hungry, let me get them a snack. Or, oh, it's a little cold in here, let me go get them their jacket. They generally tend to act out a little bit if they get too cold. They know everything about their person. And by including them in that process, they become the center of the process rather than the medical care dictating it. They have a part of it. And we can take care of them as well. And so our Caregiver Center, we saw that we wanted to be able to not only reduce caregiver burden, but enhance the training and the services that we provided around dementia. We have a staff member purely dedicated to that. She's called a dementia specialist, and she is a specialist because we understand that, okay, nationwide, the Alzheimer's and other leading dementias are the 6th leading cause of death. In the state of California, it's 4th, but in our county, it's 3rd. Our county, we are demonstrating what other counties are going to be seeing in the future. And we saw an opportunity to be a part of that supportive process. And we really wanted an environment that was compassionate and person-centered and calm and pretty. If you come into our building is unlike any other building at the district. Jay knows, Jay's been. It has nice soothing music. We have aromatherapy. We have a little library with plush chairs that you can sit in. You can check books and videos out and take them at your own pace. We wanted to create an environment that didn't make you feel like you were at a doctor's office, like you were at work, or another place that caused you stress. We wanted the Caregiver Center to be your oasis. And the thought was to be able to co-locate other types of professional services within the Caregiver Center. So we have lawyers who come and provide their time for free on Monday afternoons. Appointments are necessary, but they will meet with you about a living will, a durable power of attorney, an advanced care directive, and other types of topics like trust, etc. We have a financial planner who comes. He provides his time for free. We have individuals from HICAP, the Health Insurance Counseling and Advocacy Program, APS, Adult Protective Services, and a bunch of other professionals from the community, because we wanted to be able to improve the coordination of care while improving the access to those resources needed. Because sometimes it can feel a little like a revolving door of phone numbers. We want to make that as easy as possible. And I kind of already mentioned this to you, and I want to be mindful of our time, so I will go through this a little quickly. But as I was mentioning, in our county, Alzheimer's and other related dementias are the 3rd leading cause of death. We know that every 65 seconds, somebody is diagnosed with Alzheimer's. By 2050, that's expected to increase to every 33 seconds. And the common denominator to that is what I mentioned earlier about our aging population. We are going to have a larger aging population than we have a younger population. One of the biggest risks for developing any form of dementia is increased age. That's not a given, that's just what the research shows. And with our caregivers, we have 11 million Americans that provide unpaid care for those with Alzheimer's. Now, as I was mentioning earlier, Alzheimer's and other dementias, they're not like other chronic conditions. Other chronic conditions don't change somebody's personality. They don't make them lose the ability to speak and act out in aggressive manners. I mean, there are some that do, but generally speaking, the layer of detective work that gets added on top of caring for somebody with a form of dementia increases the workload. And what we come up against time and time again is caregivers who say, I can tell you everything about all of the medications that they take, when they need to take the medications, all of their diagnoses and things to look out for, the special diet they need, but nobody has talked to me about their dementia. No one has told me what to expect. So I feel like I'm going at this blind. We even had a caregiver not that long ago, this was about 6 weeks ago, who came in and shared, are you sure I need to get a diagnosis? Is it really gonna help? And we said, absolutely. We absolutely wanna know what's going on. You know, is it Alzheimer's? Is it something else? She said, oh yeah, because the doctor said, well, look at how old they are. Does it really matter what they have? And our mouths dropped because it absolutely matters. You matter, your person matters. You deserve to understand. They deserve that. So if there's ever a time where somebody says that, get another opinion. But when we have the information, we know how to act. We know where to go to for help. And what we are able to do at the district is we provide education around dementia. I was mentioning to you earlier that we have a staff member who's a dementia specialist. Everybody in our Caregiver Center has a lot of knowledge around dementia. Something that I want to impart, dementia is not the disease. Dementia is a term that we use to describe a set of symptoms. Alzheimer's is the disease. Lewy body dementia is the disease. Frontotemporal dementia. What the term dementia tells us is that someone is having some challenges around language, problem solving, reasoning, judgment, changes into personality. We don't realize how much of our life is a stepwise process until we are caring for somebody with dementia. So I was mentioning to you the logic, ration, reason part of the brain. That's the part of the brain that's impacted first and worst. So think about the steps it takes to tie your shoes, or to put on your pants, to take a shower, to fold a washcloth. Those are steps, and that impacts, that part of the brain is impacted. And we all have moments where we forget somebody's name, or we forget where we put the remote, or the keys, or where we parked. I once walked around a parking lot for 3 hours. My husband and I couldn't find where our car was. And so we hear a lot like, oh my gosh, does that mean I have dementia? More often than not, no. But things to look out for are, you know, the consistent forgetting of the small things like paying bills, appointments, losing things more regularly, changes in planning and problem solving, difficulty completing familiar tasks. My mother-in-law was an amazing baker, amazing. And I remember noticing, it was Christmas cookie time, and that was my absolute favorite time with her. And she'd tell you stories, and we'd decorate. I would go too far with the sprinkles. She'd tell me to dial it back a bit. And I saw that this recipe that she had been doing for so long suddenly was hard. And I remember thinking, uh-oh, how am I gonna tell my husband this? Maybe I'm just being too sensitive, because this is what I do. This is my life, this is my work. And it was shortly thereafter that we found out. But listen to your gut. If your gut is telling you something's not right here, they normally don't forget their appointments. They normally remember how to get home from the grocery store. Listen to that. Confusion with time and place, or problems with words and speaking or writing, misplacing things and not being able to retrace your steps, poor judgment. We see a lot of that here in Camarillo in terms of driving. Older adults who have a form of dementia who still have their license. You have to have a lot of judgment when you're behind the wheel of a car. So that's also something to consider. And changes in mood and personality. Somebody who is sweet as pie, that was my mother-in-law, when her dementia progressed, whew, she said words I didn't even know she knew. And that also adds that layer of challenge to it. But here at our Caregiver Center, what we aim to do, as I mentioned, is not be a burden, but be a place that can support you. And some of the ways that we do that, we have custom care consultations where myself or one of my staff would meet with you one-on-one, or you and your family, your siblings, your whomever, to talk about your situation. What are your stressors? What are the pain points? What are you seeing? And then we often hear the things that aren't said and can get you connected to other services and resources that would help and benefit your situation. We have support groups. We have a caregiver support group on the second and fourth Friday of every month from 9:30 to 11 in the morning. We're currently still virtual. We take a poll almost every month, and a lot of our caregivers are still choosing to remain virtual because the fear of exposing themselves to something and bringing it home to their loved one is still too high. So we will accommodate whatever it is that they need, but we are also looking at expanding our support group and offering in person at other times. We have screenings for depression and caregiver well-being. And during those screenings, we also use that as a time to talk to you about resources and services. We have a class called Powerful Tools for Caregivers. A lot of people hear that and think, oh, you're gonna teach me how to be a better caregiver. Yes, and by being a better caregiver, what we mean is we are going to teach you about you. We are going to give you tools and skills to add to that caregiving toolbox. But the focus is gonna be on you as the caregiver, not the person that you're caring for. And we talk about stress reduction strategies, assertiveness, how to hold a family meeting, how to get connected to resources, communication. We talk about I messages. Not I. We're not really taught how to talk to each other well. We do a lot of what's called you messages, like you didn't take out the trash. You need to go do this. I messages really are when this happens, I feel. So when mom misses her doctor's appointment, I feel worried that she isn't going to get the care she needs. It's not yelling at someone, it's just stating a situation and how that situation makes you feel. But that's not a tool that we're really taught. but we go over that technique and a few other communication styles. And we have a new class that we're offering called Finding Meaning and Hope. And the concept behind this is the thought of ambiguous loss. It was designed to address that, where someone is physically present and emotionally absent, or emotionally present and physically absent. We see that in those active military. They are emotionally present, but often physically absent. Those with Alzheimer's and other dementia, they're physically present and emotionally absent. And that's a challenge to work through. And so with this class, we go through tips and tools and provide you with resources on that, because ambiguity is just another challenging layer that no one talks about, and we want to change that. I talked about our legal and financial and our resource library, but we also have grant funding that we receive from the Ventura County Area Agency on Aging for both in-home respite, adult day center respite, and home modifications. Respite's just a fancy word for giving you a break. So we have agreements with a few home care agencies and are able to authorize for about 20 hours, which isn't a lot, but it's something to get you started, to get comfortable with the thought of having a stranger in the home to help. But it gives you a break to do the things that you need to do. Go get a haircut, take a nap, go to the market, and not feel like I have to rush. Gives you that time. And the home modifications would be things like grab bars, a raised toilet seat, shower hose, things to make the area safer. And I would be remiss if I did not talk about our dementia-friendly Ventura County movement. We are a part of the dementia-friendly Ventura County, and it's led by the Ventura County Area Agency on Aging, with the goal of making our county dementia-friendly. And included with that is training that we and other organizations provide to local businesses, financial institutions, restaurants, religious organizations, to their staff, to help them see the warning signs of dementia, to understand how to respond warmly and calmly, because we all like to be treated with respect. We all deserve that. And as another component of that, two other offerings that we have at the district. We have Dementia Live, which is a simulation experience of what it's like for somebody living with a form of dementia. So you put these little sunglasses on that limit your vision, so it impacts your peripheral vision, headphones that have different sounds playing, and cotton gloves. Because what dementia does is it impacts your senses. Sometimes you have the inability to filter out sounds. You don't know which is the important sound I need to focus on. Or you have auditory hallucinations. Your peripheral vision is impacted. And following that, we give you a set of tasks to complete. And then you do that for a couple minutes, and then we talk about how you felt. And it's a pretty powerful and moving experience to understand what somebody's living with day in and day out. And then a Dealing with Dementia workshop is designed for those who are caring for somebody with a form of dementia. And we provide education on what dementia is, on ways to reduce caregiver stress and burden, on ways to problem solve problematic behaviors like wandering or problems with hygiene and toileting, food time, communication, and to help in that caregiving process. Another thing that we have at the Camarillo Health Care District is an adult day center. And our adult day center is different from some of the others in the county. We are a social model. So it's not just bringing somebody and plopping them in front of a TV. There are activities throughout the day, meals and snacks, art and music, exercise. They have like a little putt-putt golf thing that they set up. One of my coworkers will go in and play the piano and sing for them. I mean, it's a lot of fun. And what we know about those living with a form of dementia is socialization and structure are very, very beneficial. And that's what adult day centers are able to provide. We have a senior support line, which is another grant-funded program provided through the Ventura County Area Agency on Aging. It is a warm line designed to reduce isolation, depression, and get individuals connected to the resources that they may need. We have trained staff who man the lines. It's open Monday through Friday, 8 to 5, and we have a roster of clients that we call weekly, and we have some that we even call every day. And we can accept calls and we can make calls. And our Healthy Attitudes magazine, you might see this in the mail if you're a Camarillo resident. It comes out every quarter, and it lists all of our upcoming classes and services that we have. I strongly encourage you to take a look at that and not just chuck it in the trash like some may do, because you'll see additional opportunities for education and support. Our senior nutrition program is frozen or ready to heat meals for those who are 60 and older and homebound. Other than that, there are no qualifications, just 60 and older and no longer driving. If they are driving, then it's minimal, and we have a note from the doctor. But what this does is we bring food to you that was approved by the county's dietitian that meets the federal guidelines, and it has a protein, a whole grain, and a vegetable, and then you have sides: shelf-stable milk, fresh fruit, fruit cups, applesauce, bread and butter. And we've seen since the pandemic, everybody thought, oh, once the pandemic ends, everything's gonna go back to normal. No. Pre-pandemic, we served about 120 clients a month, and we thought, wow, we are serving so many people. At the peak of the pandemic, it was over 400 clients a month, but now we've stabilized to about 250, and I don't see us ever returning to 120. And it's a great supportive program. We have transportation services where we are door through door, which is different than a lot of the others. We don't just leave you at the curb. We will help you, and we'll come into your home and help escort you and help get you on, and then take you into that appointment. Right now we have a grant that has free rides for those who reside in Camarillo, with the ride originating here in Camarillo. Free rides through the end of June. So it doesn't have to just be to a doctor's office. It can be for errands and other things. So please take advantage of that. You see the hours Monday through Friday, 8 to 4. We have some fitness opportunities, a walking group Tuesday and Thursday morning, Tai Chi for arthritis, bingo size, yoga. These are all of our fabulous and fun fall prevention classes, and some other classes as well that I've kind of already touched upon. But Share is another program that we have that is a 2-on-1, and what that means is a trained staff with an individual who's diagnosed with early to early mid-stage dementia or Alzheimer's or another form, and their caregiver. And what that does is it helps, over the course of 6 sessions, lay out a care plan and plans for the future in terms of, these are the things that I may need help with, and we've identified people who may be able to help us with that, and talks about your own goals and ways to get there. We have programs that impact digital literacy, where we can help train on how to use your computer, tablet, smartphone. We have classes on virtual scrapbooking, virtual reality, Google Slides. Our virtual reality program is so fun to travel to places that you maybe have always wanted to go but haven't had the opportunity. It's a great, safe way to do that. Okay. And I'm just looking at our time. Our video on our Senso Balance machine is on our website, and I strongly encourage you to look at that. Our Senso Balance machine does what's called dual tasking. So it's not just physical movement, but it's also your reaction, your cognitive reaction. It's a lot of fun. It feels like you're playing that game, Dance Dance Revolution, but it's helping to improve or decrease the likelihood for a fall. And so I wanted to share with you one last thing. We have a grant right now that we are providing elder legal educational seminars once a month here in this room at the library, obviously, on the third Monday of every month. We just held our first one last week. So next month we are having a lawyer come and do a presentation on, it's titled, "What Happens If I Don't Die?" And what he's talking about is legal planning for incapacity. We don't ever want to have that happen. Nobody ever thinks that's gonna happen. But really the goal of that presentation is making sure that your wishes are known. Because I can share personally, my father did not make his wishes known. He had a massive heart attack, and I was the one left to make that decision. Everybody deserves to have their wishes known and to be respected, because what happens is you leave those going, gosh, I hope I made the right decision. I hope they would be okay with the decision that I made. And yes, it's scary to talk about those things, but every one of us deserves to have those things in place. And then some of our other topics are going to be around nursing homes, what you need to know if hiring a caregiver privately, do you know your housing rights, knowing and accessing your VA benefits. So we're gonna have a wide variety of speakers throughout the remainder of this year. We really hope to see you at these seminars. So that brings me to the end. Are there any questions?